Hello, Team Special Olympics. I've got terrific news. The health revolution in our movement is continuing, and the doors of opportunity are swinging open for programs, states, countries around the world to join the healthy community's ideals and embrace the promise that Special Olympics has made to ensure that we do everything within our power so that every athlete who comes to compete is as healthy an athlete as he or she can possibly be. So many of you know the history. We were started as a movement dedicated to the simple idea that by participating in sports, people with intellectual differences could show the world their skills, their capacities, their joy, their openness, their sharing, their enormous spirit. And for many, many decades, that indeed was the promise fulfilled. In villages, in cities, in states, in provinces and prefectures all over the world, our athletes went to playing fields. By the millions, they competed, they ran, they swam, they joined teams, and the eyes of the world were opened. But a few years ago, with those open eyes, we saw something that scandalized us. Many of our athletes coming to those playing fields with enormous health problems, problems in the oral cavity, problems in their feet, problems with their eyes, problems in their ears. And we wondered, what is the cause? We found discrimination. We found injustice. We found intolerance, even in the halls of medicine. We found an entire system not yet ready to respect the dignity of people with intellectual disabilities. And so we acted. Many of you, pioneers, putting out the tents, inviting doctors, physicians, and healthcare professionals to create healthy athletes education centers, screening centers, even glasses distribution centers, ways in which we could ensure that every athlete who came to us had the best chance they could of being healthy. Now that revolution continues. We not only want that opportunity for those who come to us, but we want to challenge those healthcare providers who are our friends and those who are yet to learn to create communities of care that survive well beyond our games. We want to invite them to come to our games to see the need, to see and recognize the levels of disparities, the levels of injustice, the levels of challenge faced by people with intellectual disabilities when they try to simply access the gift of good care. Healthy Communities has been started through the generosity of the Golisano Foundation in countries and states around the world. Now it's the time for so many others of you who would like to make your own healthy communities a reality to join this revolution, to build out the networks, to invite the kinds of care providers who can make a difference, to knead them together into a community of care. In the future, we still want every Special Olympics athlete to be as healthy and as capable of competing to the best of their ability as is humanly possible. But we also want to challenge all the healthcare systems, from training to clinical care to hospitals and emergency places. We want to challenge them all. Be a healthy community for people with intellectual and developmental differences. Make it your work to ensure that when a person with an intellectual disability knocks on the door, asking for help, asking for care, asking to be healthy, the answer they get is yes, we are a healthy community. Come right in. We'll do our best for you. That's a promise worthy of the history of the Special Olympics movement, but it's also a promise we should commit to for the future. Thanks for being part of the health revolution, all of you, and thanks to those of you who will embrace the ideals of a healthy community.